think it's very valuable for a patient to ask questions about what they should be expecting, because it takes away some of that anxiety. In that way, she can sort of express what she needs and the doctor can help provide that. When we are dealing with breast cancers, we want to know if the tumor is sensitive to estrogen, progesterone, and we want to know if that tumor expresses a protein on its cell surface called HER2.
Estrogen receptor positive breast cancer means that there are receptors on the cancer cell that the hormone estrogen binds to. Estrogen then fuels the growth and spread of the cancer. Progesterone receptor positive breast cancer is similar, but it's the hormone progesterone that binds to the cell and fuels its growth. Alternatively, a person is diagnosed with HER2 positive breast cancer if there is an overabundance of the HER2 protein along the surface of their cancer cells. Doctors commonly diagnose estrogen, progesterone, and HER2 positive breast cancer by carefully examining biopsies of a person's tumor, confirming the presence of these hormones or proteins.
Your receptor status will affect your treatment because if a tumor is estrogen receptor positive, we can treat that tumor with an estrogen blocker. If you have a tumor that has an overexpression of HER2, that protein that sits on the cell surface, there are too many copies of that protein. We have immunotherapy that can target those cells, latch on to that HER2 protein, and kill that cell. A triple negative cancer is a cancer that does not have receptors for estrogen, does not have receptors for progesterone, and does not have that HER2 protein on its cell surface. So we cannot use anti-estrogens to treat those tumors, and we can't use that immunotherapy that targets the HER2 protein. So the mainstay of treatment is chemotherapy.
Another factor that may affect your prognosis and treatment option is your breast cancer stage.
Early stage breast cancer would be considered cancer that's contained within the breast area and or the lymph nodes. Once that cancer cell breaks off and spreads and starts growing somewhere else, that is considered late stage disease, and that stage 4 disease if it's growing in the bone, the liver, the lung. So the earlier you find a cancer, usually we're hoping we can give less treatment. If you're overwhelmed and struggling with a diagnosis of breast cancer, you can definitely speak to your doctor, because your doctor can certainly offer support and help you through this very difficult time.